Which comment made by a new mother to her own mother is most likely to encourage the grandmother's participation in the infant's care? A. Could you help me with the housework today? B. The baby is spitting up a lot. What should I do? C. I know you are busy, so I'll get John's mother to help me. D. The baby has a stomachache. I'll call the nurse to find out what to do. Answer. B. The baby is spitting up a lot. What should I do? Rationale. Looking to the grandmother for advice encourages her to become involved in the care of the infant. Housework does not encourage the grandmother to participate in the infant's care. Getting John's mother to help and calling the nurse about advice excludes the grandmother. A pregnant woman notices that she is beginning to develop dark skin patches on her face. She denies using any different type of facial products as a cleansing solution or makeup. What would the priority nursing intervention be in response to this situation? A. Refer the patient to a dermatologist for further examination. B. Ask the patient if she has been eating different types of foods. C. Take a culture swab and send to the lab for culture and sensitivity, CNS. D. Let the patient know that this is a common finding that occurs during pregnancy. Answer. D. Let the patient know that this is a common finding that occurs during pregnancy. Rationale. This condition is known as Chloasma or Melasma, mask of pregnancy, and is a result of pigmentation changes relative to hormones. It can be exacerbated by exposure to the sun. There is no need to refer to a dermatologist. Intake of foods is not associated with exacerbation of this process. There is no need for a CNS to be taken. The patient should be assured that this is a normal finding of pregnancy. Which physiologic findings related to gallbladder function may lead to the development of gallstones during pregnancy? A. Decrease in alkaline phosphatase levels compared with non-pregnant women. B. Increase in albumin and total protein as a result of hemodilution. C. Hypertonicity of gallbladder tissue. D. Prolonged emptying time. Answer. D. Prolonged emptying time. Rationale. Prolonged emptying time is seen during pregnancy and may lead to the development of gallstones. In pregnancy, there is a twofold to fourfold time increase in alkaline phosphatase levels as compared with those in non-pregnant women. During pregnancy, a decrease in albumin level and total protein is seen as a result of hemodilution. Gallbladder tissue becomes hypotonic during pregnancy. While providing education to a primiparous patient regarding the normal changes of pregnancy, what is an important information for the nurse to share regarding Braxton Hicks contractions? A. These contractions may indicate preterm labor. B. These are contractions that never cause any discomfort. C. Braxton Hicks contractions only start during the third trimester. D. These occur throughout pregnancy, but you may not feel them until the third trimester. Answer. D. These occur throughout pregnancy, but you may not feel them until the third trimester. Rationale. Throughout pregnancy, the uterus undergoes irregular contractions called Braxton Hicks contractions. During the first 2 trimesters, the contractions are infrequent and usually not felt by the woman until the third trimester. Braxton Hicks contractions do not indicate preterm labor. Braxton Hicks contractions can cause some discomfort, especially in the third trimester. Braxton Hicks contractions occur throughout the whole pregnancy. Which of these findings would indicate a potential complication related to renal function during pregnancy? A. Increase in glomerular filtration rate, GFR. B. Increase in serum creatinine levels. C. Decrease in blood urea nitrogen, BUN. D. Mild proteinuria. Answer: B. Increase in serum creatinine level. Rationale: with pregnancy, one would expect the serum creatinine and BUN levels to decrease. An elevation in the serum creatinine level should be investigated. With pregnancy, the GFR increases because of increased renal blood flow and is thus a normal expected finding. A decrease in the blood urea nitrogen level and mild proteinuria is expected findings in pregnancy. Physiologic anemia often occurs during pregnancy due to a. Inadequate intake of iron. B. The fetus establishing iron stores. C. Dilution of hemoglobin concentration. D. Decreased production of erythrocytes. Answer: C. Dilution of hemoglobin concentration. Rationale: when blood volume expansion is more pronounced and occurs earlier than the increase in red blood cells, the woman will have physiologic anemia, which is the result of dilution of hemoglobin concentration rather than inadequate hemoglobin. Inadequate intake of iron may lead to true anemia. If the woman does not take an adequate amount of iron, true anemia may occur when the fetus pulls stored iron from the maternal system. There is increased production of erythrocytes during pregnancy. An expected change during pregnancy is a darkly pigmented vertical mid-abdominal line. The nurse recognizes this alteration as a. Epulus B. Linea nigra C. Melasma D. Striae gravidarum. Answer: B. Linea nigra. Rationale: the linea nigra is a dark pigmented line from the fundus to the symphysis pubis. Epulus refers to gingival hypertrophy. Melasma is a different kind of dark pigmentation that occurs on the face. Striae gravidarum, stretch marks, are lines caused by lineal tears that occur in connective tissue during periods of rapid growth. Which physiologic adaptation of pregnancy may lead to increased constipation during the pregnancy? A. Increased emptying time in the intestines. B. Abdominal distension and bloating. C. Decreased absorption of water. D. Decreased motility in the intestines. Answer: D. Decreased motility in the intestines. Rationale: decreased motility in the intestines leading to increased water absorption would cause constipation. Increased emptying time in the intestines leads to increased nutrient absorption. Abdominal distension and bloating are a result of increased emptying time in the intestines. Decreased absorption of water would not cause constipation. 36-year-old divorcee with a successful modeling career finds out that her 18-year-old daughter is expecting her first child. Which is a major factor in determining how this woman will respond to becoming a grandmother? A. Her age. B. Her career. C. Being divorced. D. Age of the daughter. Answer: A. Her age. Rationale: age is a major factor in determining the emotional response of prospective grandparents. Young grandparents may not be happy with the stereotype of grandparents as being old. Career responsibilities may have demands that make the grandparents not as accessible but are not a major factor in determining the woman's response to becoming a grandmother. Being divorced is not a major factor that determines the adaptation of grandparents. The age of the daughter is not a major factor that determines the adaptation of grandparents. The age of the grandparent is a major factor. A patient in her first trimester complains of nausea and vomiting. The patient asks, "Why is this happening?" What is the nurse's best response? A. It is due to an increase in gastric motility. B. It may be due to changes in hormones. C. It is related to an increase in glucose levels. D. It is caused by a decrease in gastric secretions. Answer: B. It may be due to changes in hormones. Rationale. Nausea and vomiting are believed to be caused by increased levels of hormones, decreased gastric motility, and hypoglycemia. Gastric motility decreases during pregnancy. Glucose levels decrease in the first trimester. Gastric secretions decrease, but this is not the main cause of nausea and vomiting. A pregnant woman complains of frequent heartburn. The patient states that she has never had these symptoms before and wonders why this is happening now. The most appropriate response by the nurse is to A. Examine her dietary intake pattern and tell her to avoid certain foods. B. Tell her that this is a normal finding during early pregnancy and will resolve as she gets closer to term. C. Explain to the patient that physiologic changes caused by the pregnancy make her more likely to experience these types of symptoms. D. Refer her to her healthcare provider for additional testing because this is an abnormal finding. Answer. C. Explain to the patient that physiologic changes caused by the pregnancy make her more likely to experience these types of symptoms. Rationale. The presentation of heartburn is a normal abnormal finding that can occur in pregnant women because of relaxation of the lower esophageal sphincter as a result of the physiologic effects of pregnancy. Although foods may contribute to the heartburn, the patient is asking why this presentation is occurring, so the nurse should address the cause first. It is independent of gestation. There is no need to refer to the physician at this time because this is a normal abnormal finding. There is no evidence of complications ensuing from this presentation. A patient who is 7 months pregnant states, "I'm worried that something will happen to my baby." Which is the nurse's best response? A. Your baby is doing fine. B. Tell me about your concerns. C. There is nothing to worry about. D. The doctor is taking good care of you and your baby. Answer. B. Tell me about your concerns. Rationale. Encouraging the patient to discuss her feelings is the best approach. The nurse should not disregard or belittle the patient's feelings. Responding that your baby is doing fine disregards the patient's feelings and treats them as unimportant. Responding that there is nothing to worry about does not answer the patient's concerns. Saying that the doctor is taking good care of you and your baby is belittling the patient's concerns. Which situation best describes a man trying on fathering behaviors? A. Reading books on newborn care. B. Spending more time with his siblings. C. Coaching a little league baseball team. D. Exhibiting physical symptoms related to pregnancy. Answer. C. Coaching a little league baseball team. Rationale. Coaching a little league baseball team shows interaction with children and assuming the behavior and role of a father. This best describes a man trying on the role of being a father. Men do not normally read information that is provided in advance. The nurse should be prepared to present information after the baby is born, when it is more relevant. The man will normally seek closer ties with his father. Exhibiting physical symptoms related to pregnancy is called couvade. The nurse is teaching a pregnant patient about signs of possible pregnancy complications. Which should the nurse include in the teaching plan? Select all that apply. A. Report watery vaginal discharge. B. Report puffiness of the face or around the eyes. C. Report any bloody show when you go into labor. D. Report visual disturbances, such as spots before the eyes. E. Report any dependent edema that occurs at the end of the day. Answer. A. Report watery vaginal discharge. B. Report puffiness of the face or around the eyes. D. Report visual disturbances, such as spots before the eyes. Rationale. Watery vaginal discharge could mean that the membranes have ruptured. Puffiness of the face or around the eyes and visual disturbances may indicate preeclampsia or eclampsia. These 3 signs should be reported. Bloody show as labor starts may mean the mucus plug has been expelled. One of the earliest signs of labor may be bloody show, which consists of the mucus plug and a small amount of blood. This is a normal occurrence. Up to 70% of women have dependent edema during pregnancy. This is not a sign of a pregnancy complication. Which finding is a positive sign of pregnancy? A. Amenorrhea. B. Breast changes. C. Fetal movement felt by the woman. D. Visualization of fetus by ultrasound. Answer: D. Visualization of fetus by ultrasound. Rationale: the only positive signs of pregnancy are auscultation of fetal heart tones, visualization of the fetus by ultrasound, and fetal movement felt by the examiner. Amenorrhea is a presumptive sign of pregnancy. Breast changes are a presumptive sign of pregnancy. Fetal movement is a presumptive sign of pregnancy. The patient has just learned that she is pregnant and overhears the gynecologist saying that she has a positive Chadwick's sign. When the patient asks the nurse what this means, how would the nurse respond? A. Chadwick's sign signifies an increased risk of blood clots in pregnant women because of a congestion of blood. B. That sign means the cervix has softened as the result of tissue changes that naturally occur with pregnancy. C. This means that a mucus plug has formed in the cervical canal to help protect you from uterine infection. D. This sign occurs normally in pregnancy, when estrogen causes increased blood flow in the area of the cervix. Answer: D. This sign occurs normally in pregnancy, when estrogen causes increased blood flow in the area of the cervix. Rationale: increasing levels of estrogen cause hyperemia, congestion with blood, of the cervix, resulting in the characteristic bluish-purple color that extends to include the vagina and labia. This discoloration, referred to as Chadwick's sign, is one of the earliest signs of pregnancy. Although Chadwick's sign occurs with hyperemia, congestion with blood, the sign does not signify an increased risk of blood clots. The softening of the cervix is called Goodell's sign, not Chadwick's sign. Although the formation of a mucus plug protects from infection, it is not called Chadwick's sign. Which comment made by a patient in her first trimester indicates ambivalent feelings? A. My body is changing so quickly. B. I haven't felt well since this pregnancy began. C. I'm concerned about the amount of weight I've gained. D. I wanted to become pregnant, but I'm scared about being a mother. Answer: D. I wanted to become pregnant, but I'm scared about being a mother. Rationale: ambivalence refers to conflicting feelings. Expressing a concern about being a mother indicates possible ambivalent feelings. Not feeling well since the pregnancy began does not reflect conflicting feelings. The woman is trying to confirm the pregnancy when she is stating the rapid changes to her body. She is not expressing conflicting feelings. By expressing concerns over gaining weight, which is normal, the woman is trying to confirm the pregnancy. The nurse is assessing a patient in her 37th week of pregnancy for the psychological responses commonly experienced as birth nears. Which psychological responses should the nurse expect to evaluate? Select all that apply. A. The patient is excited to see her baby. B. The patient has not started to prepare the nursery for the new baby. C. The patient expresses concern about how to know if labor has started. D. The patient and her spouse are concerned about getting to the birth center in time. E. The patient and her spouse have not discussed how they will share household tasks. Answer: A. The patient is excited to see her baby. C. The patient expresses concern about how to know if labor has started. D. The patient and her spouse are concerned about getting to the birth center in time. Rationale. As birth nears, the expectant patient will express a desire to see the baby. Most pregnant patients are concerned with their ability to determine when they are in labor. Many couples are anxious about getting to the birth facility in time for the birth. As birth nears, a nesting behavior occurs, which means getting the nursery ready. Not preparing the nursery at this stage is not a response that the nurse should expect to assess. Negotiation of tasks is done during this stage. Discussion regarding the division of household chores is not a response that the nurse should expect to assess at this stage. During vital sign assessment of a pregnant patient in her third trimester, the patient complains of feeling faint, dizzy, and agitated. Which nursing intervention is most appropriate? A. Have the patient stand up and retake her blood pressure. B. Have the patient sit down and hold her arm in a dependent position. C. Have the patient turn to her left side and recheck her blood pressure in 5 minutes. D. Have the patient lie supine for 5 minutes and recheck her blood pressure on both arms. Answer. C. Have the patient turn to her left side and recheck her blood pressure in 5 minutes. Rationale. Blood pressure is affected by positioning during pregnancy. The supine position may cause occlusion of the vena cava and descending aorta. Turning the pregnant woman to a lateral recumbent position alleviates pressure on the blood vessels and quickly corrects supine hypotension. Pressures are significantly higher when the patient is standing. This would cause an increase in systolic and diastolic pressures. The arm should be supported at the same level of the heart. The supine position may cause occlusion of the vena cava and descending aorta, creating hypotension. A patient relates a story of how her boyfriend is feeling her aches and pains associated with her pregnancy. She is concerned that her boyfriend is making fun of her concerns. How would you respond to this patient statement? A. Tell her not to worry because it is natural for her boyfriend to make her feel better by identifying with her pregnancy. B. Refer the patient to a psychologist for counseling to deal with this problem because it is clearly upsetting her. C. Explain that her boyfriend may be experiencing Couvaide syndrome and that this is a normal finding seen with male partners. D. Ask the patient specifically to define her concerns related to her relationship with her boyfriend and suggest methods to stop this type of behavior by her significant other. Answer. C. Explain that her boyfriend may be experiencing Couvaide syndrome and that this is a normal finding seen with male partners. Rationale. Provide factual information that will help reduce stress and modify acceptance. Telling her not to worry does not address the possibility that her boyfriend may be experiencing Couvaide syndrome. The patient is expressing concern but does not have all the facts related to Couvaide syndrome and requires education, rather than referral. Couvaide syndrome is not an abnormal condition and should be treated with acceptance and understanding. Which comment made by a new mother exhibits understanding of her toddler's response to a new sibling? A. I can't believe he is sucking his thumb again. B. He is being difficult and I don't have time to deal with him. C. When we brought the baby home, we made Michael stop sleeping in the crib. D. My husband is going to stay with the baby so I can take Michael to the park tomorrow. Answer. D. My husband is going to stay with the baby so I can take Michael to the park tomorrow. Rationale. It is important for a mother to seek time alone with her toddler to reassure him that he is loved. It is normal for a child to regress when a new sibling is introduced into the home. The toddler may have feelings of jealousy and resentment toward the new baby taking attention away from him. Frequent reassurance of parental love and affection is important. Changes in sleeping arrangements should be made several weeks before the birth so the child does not feel displaced by the new baby. What is the best explanation that the nurse can provide to a patient who is concerned that she has pseudoanemia of pregnancy? A. Have her write down her concerns and tell her that you will ask the physician to respond once the lab results have been evaluated. B. Tell her that this is a benign self-limiting condition that can be easily corrected by switching to a high-iron diet. C. Inform her that because of the pregnancy, her blood volume has increased, leading to a substantial dilution effect on her serum blood levels, and that most women experience this condition. D. Contact the physician and get a prescription for iron pills to correct this condition. Answer. C. Inform her that because of the pregnancy, her blood volume has increased, leading to a substantial dilution effect on her serum blood levels, and that most women experience this condition. Rationale. Providing factual information based on physiologic mechanisms is the best option. Although having the patient write down her concerns is reasonable, the nurse should not refer this conversation to the physician but rather address the patient's specific concerns. Switching to a high-iron diet will not correct this condition. This physiologic pattern occurs during pregnancy as a result of hemodilution from excess blood volume. Iron medication is not indicated for correction of this condition. There is no need to contact the physician for a prescription. What is the physiologic reason for vascular volume increasing by 40% to 60% during pregnancy? A. Prevents maternal and fetal dehydration. B. Eliminates metabolic wastes of the mother. C. Provides adequate perfusion of the placenta. D. Compensates for decreased renal plasma flow. Answer. C. Provides adequate perfusion of the placenta. Rationale. The primary function of increased vascular volume is to transport oxygen and nutrients to the fetus via the placenta. Preventing maternal and fetal dehydration is not the primary reason for the increase in volume. Assisting with pulling metabolic wastes from the fetus for maternal excretion is one purpose of the increased vascular volume. Renal plasma flow increases during pregnancy. Which physiologic finding is consistent with normal pregnancy? A. Systemic vascular resistance increases as blood pressure decreases. B. Cardiac output increases during pregnancy. C. Blood pressure remains consistent independent of position changes. D. Maternal vasoconstriction occurs in response to increased metabolism. Answer. B. Cardiac output increases during pregnancy. Rationale. Cardiac output increases during pregnancy as a result of increased stroke volume and heart rate. Systemic vascular resistance decreases while blood pressure remains the same. Maternal blood pressure changes in response to patient positioning. In response to increased metabolism. Maternal vasodilation is seen during pregnancy. The capacity of the uterus in a term pregnancy is how many times its prepregnant capacity. Record your answer as a whole number. Answer. 500. Rationale. The prepregnant capacity of the uterus is about 10 milliliters, and it reaches 5,000 milliliters, 5L, by the end of the pregnancy, which reflects a 500-fold increase. Which findings are presumptive signs of pregnancy? Select all that apply. A. Quickening. B. Amenorrhea. C. Ballottement. D. Goodell's sign. E. Chadwick's sign. Answer. A. Quickening. B. Amenorrhea. E. Chadwick's sign. Rationale. Quickening. amenorrhea, and Chadwick's sign are presumptive signs of pregnancy. Ballottement and Goodell's sign are probable signs of pregnancy. A patient reports to the clinic nurse that she has not had a period in over 12 weeks, she is tired, and her breasts are sore all of the time. The patient's urine test is positive for HCG. What is the correct nursing action related to this information? A. Ask the patient if she has had any nausea or vomiting in the morning. B. Schedule the patient to be seen by a healthcare provider within the next 4 weeks. C. Send the patient to the maternity screening area of the clinic for a routine ultrasound. D. Determine if there are any factors that might prohibit her from seeking medical care. Answer. D. Determine if there are any factors that might prohibit her from seeking medical care. Rationale. The patient has presumptive and probable indications of pregnancy. However, she has not sought out health care until late in the first or early in the second trimester. The nurse must assess for barriers to seeking health care, physical or emotional. Because regular prenatal care is key to a positive pregnancy outcome, asking if the patient has nausea or vomiting will only add to the list of presumptive signs of pregnancy. And this information will not add to the assessment data to determine whether the patient is pregnant. The patient needs to see a healthcare provider before the next 4 weeks because she is late in seeking early prenatal care. Ultrasound testing must be prescribed by a healthcare provider. A pregnant woman has come to the emergency department with complaints of nasal congestion and epistaxis. Which is the correct interpretation of these symptoms by the healthcare provider? A. Nasal stuffiness and nosebleeds are caused by a decrease in progesterone. B. These conditions are abnormal. Refer the patient to an ear, nose, and throat specialist. C. Estrogen relaxes the smooth muscles in the respiratory tract, so congestion and epistaxis are within normal limits. D. Estrogen causes increased blood supply to the mucous membranes and can result in congestion and nosebleeds. Answer. D. Estrogen causes increased blood supply to the mucous membranes and can result in congestion and nosebleeds. Rationale. As capillaries become engorged, the upper respiratory tract is affected by the subsequent edema and hyperemia, which causes these conditions, seen commonly during pregnancy. Progesterone is responsible for the heightened awareness of the need to breathe in pregnancy. Progesterone levels increase during pregnancy. The patient should be reassured that these symptoms are within normal limits. No referral is needed at this time. Relaxation of the smooth muscles in the respiratory tract is affected by progesterone. An expectant patient in her 3rd trimester reports that she developed a strong tie to her baby from the beginning and now is really in tune to her baby's temperament. The nurse interprets this as the development of which maternal task of pregnancy? A. Learning to give of herself. B. Developing attachment with the baby. C. Securing acceptance of the baby by others. D. Seeking safe passage for herself and her baby. Answer. B. Developing attachment with the baby. Rationale. Developing a strong tie in the 1st trimester and progressing to be in tune is the process of commitment, attachment, and interconnection with the infant. This stage begins in the 1st trimester and continues throughout the neonatal period. Learning to give of herself is the task that occurs during pregnancy as the woman allows her body to give space to the fetus. She continues with giving to others in the form of food and presents. Securing acceptance of the baby is a process that continues throughout pregnancy as the woman reworks relationships. Seeking safe passage is the task that ends with birth. During this task, the woman seeks health care and carries out cultural practices. What is the term for the step in maternal role attainment that relates to the woman giving up certain aspects of her previous life? A. Fantasy. B. Grief work. C. Role playing. D. Looking for a fit. Answer. B. Grief work. Rationale. The woman experiences sadness as she realizes that she must give up certain aspects of her previous self and that she can never go back. This is called grief work. Fantasies allow the woman to try on a variety of possibilities or behaviors. This usually deals with how the child will look and the characteristics of the child. Role-playing involves searching for opportunities to provide care for infants in the presence of another person. Looking for a fit is when the woman observes the behaviors of mothers and compares them with her own expectations. An expectant couple asks the nurse about intercourse during pregnancy and whether it is safe for the baby. What information should the nurse provide? A. Intercourse is safe until the third trimester. B. Safer sex practices should be used once the membranes rupture. C. Intercourse should be avoided if any spotting from the vagina occurs afterward. D. Intercourse and orgasm are often contraindicated if a history of or signs of preterm labor are present. Answer. D. Intercourse and orgasm are often contraindicated if a history of or signs of preterm labor are present. Rationale. Uterine contractions that accompany orgasm can stimulate labor and would be problematic if the woman is at risk for or has a history of preterm labor. Intercourse can continue as long as the pregnancy is progressing normally. Rupture of the membranes may require abstaining from intercourse. Safer sex practices are always recommended. Some spotting can normally occur as a result of the increased fragility and vascularity of the cervix and vagina during pregnancy. A pregnant patient comes into the medical clinic stating that her family and friends are telling her that she is always talking about the pregnancy and nothing else. She is concerned that something is wrong with her. What psychological behavior is she exhibiting? A. Antepartum obsession. B. Ambivalence. C. Uncertainty. D. Introversion. Answer. D. Introversion. Rationale. The patient is exhibiting behaviors associated with introversion and/or narcissism. These are normal findings during pregnancy as long as they do not become obsessive to the exclusion of everything else. The patient is talking about the pregnancy, but there is no evidence that it is affecting her perception of reality and/or ability to perform ADLs. It is normal for pregnant women to focus on the self as being of prime importance in their life initially during the pregnancy. Some women may feel ambivalent about their pregnancy, which is a normal reaction. However, this patient's behavior does not support this finding. Some women react with uncertainty at the news of being pregnant, which is a normal reaction. However, this patient's behavior does not support this finding.